Okay, I want to show you guys how I do metronidazole. Liquid IV suspension. Metronidazole, 500 milligrams, it's 5 mg per ml. Not explaining what that means, you figure it out. I have to give this dog 140 mg of IV metronidazole over like 30 minutes. So what you do is you do 140 divided by 5, because it's 5 mg per ml. I have to give this dog 28 mLs. I have all of my necessities. This is a 35 ml syringe. And then I have a needle here. Try to keep everything sterile as possible. You can use gloves. I'm not going to use gloves because I'm going to do everything as sterile as possible. Metronidazole is light sensitive, so it stays in these like whatever pouches. And I'm also going to have vet wrap. I'm going to wrap the syringe in it before I put it in the syringe pump, which I'll show you how to do that as well. So like I said, I did 40 divided by, or 140, because I'm giving the dog 140 milligrams. I divide that by 5 mgs per ml for metronidazole. That's 28 mLs. So put it in here. I'm gonna pull up 28 mLs. You'll be here for a while. Realistically speaking, I should keep it in here while I'm pulling it up, just to keep it light sensitive. And I could use an 18 gauge, which makes it a lot faster. I just don't want to puncture a giant hole into the bag itself, so that's why I'm using a 22 gauge. And we'll do 28 mLs. I'll be back. Okay, now that I have it in the syringe, 28 mLs, I'm going to take this extension set here because the dog is already on fluid. I'm going to attach the syringe without touching everything to the extension line. It still has a cap on it, and I'm going to push some into the line so that there's no air flowing into the patient's line. Once it's there, I'm going to keep it, and I'm just going to cap this off. I then am going to wrap this just once around the actual syringe because it's light sensitive, like I said. So, but I also don't want it to be too thick so that it doesn't fit into the syringe pump. Because the syringe pump is what's going to be manually pushing the drug, so that I don't have to do it. It's going to do it for me over, and it's time lapse, so it's over like 30 minutes. I'm going to use the same needle that I used earlier. I'm going to take this cap off there, keep everything as sterile as possible. Like I said, I could be using gloves, but this is the syringe pump. I put it in there, and then you're going to want to latch it in here like this. Turn this on. Remember, I have 28 mLs. Verify, I believe that's the thing. The rate is going to be double the amount that we're doing. So 28 times 2. So I'm going to do the rate. I'm going to put 56. 56, confirm. The volume, yes. Volume to be infused is 28 mLs that we're doing. And then it should automatically put how long that it's going to take. It's going to take 30 minutes. And then we're going to start it. But I'm going to show you how I hook it up to the patient first. This patient is already on some fluids. And they have a T-port right here. So I'm going to connect this into there so that it flows with its already fluids into its catheter, which is here. The line itself is already prepped with the medication so that when I attach it right here and it starts to pump, there's no air that's going to flow into his catheter because we don't want air. Air can cause problems. I'll explain that later. And all I'm going to do is press start infusion, and it should, I'm going to leave it here. It should move this by itself. I have this covered. And it should just move around here, go through this. And I'm just gonna do this so that gravity works. Does its thing. And hi, you're getting drugs. And the last thing I recommend is putting, when you open this package, and the time and your initials, and then you put this back where you found it. And that is how you give metronidazole over 30 minutes to a patient that needs it. Usually patients that have diarrhea, dehydration need metronidazole. It helps with the GI tract, and you give it over 30 minutes because it's a harsh drug, and the fluids that are already running, which are these ones, is going to dilute it even more, so that when the patient gets the drugs, it doesn't cause any GI upset in it. If anything, it's going to make the diarrhea subside.